Welcome to 10-Minute Health Tech, the AI-powered podcast where we dive into healthcare technologies and companies so you don't have to. I'm Anthony.
And I'm Julia, and today we're diving deep into Icon Health.
Icon Health. Okay.
They're trying to completely change how we manage orthopedic care.
Oh, wow. So from what I've read, it seems like they're all about better orthopedic care, but also trying to make it more affordable.
Yeah, exactly.
So
Not easy.
It's really hard. But their approach is super interesting. What really makes Icon Health stand out is that they aren't just zeroing in on one little part of the problem,
Right.
They're working with everybody, like health plans and then organizations that are focused on value-based care
Oh, okay.
providers and even the patients themselves.
So they're really trying to make the whole experience better for everyone involved, not just, one specific group.
Exactly. And a big way they're doing that is through what they call a full risk model.
A full risk model. Yeah. This is where things get really innovative. So basically, they take on full financial responsibility for a patient's orthopedic care.
Wow. So it's like they're saying, we're so confident that we can improve care and lower costs that we're willing to put our money where our mouth is.
Yeah, that's a great way to put it. I mean, because they're taking on that risk, their goals are totally aligned with getting the best possible outcome for patients.
Makes sense. If a patient doesn't get good results, then Icon Health is the one, who takes the hit financially.
Right.
So how do they actually make this work? What's the secret sauce?
Well, AI plays a big role, especially when it comes to reaching out to patients.
Okay.
They have these sophisticated algorithms that can predict which patients would benefit most from Icon's services.
Wow. So they're using AI to find the people who might need help before they even know they need help?
Yeah.
It's wild.
Yeah, it is. And it doesn't stop there. They use this, what they call a multi-channel approach. So that's emails, text messages, phone calls to connect with those patients and really get them, actively engaged in their own care journey.
Interesting. But I mean, do people actually respond to those messages? I feel I don't know about you, but I feel like I'm bombarded with healthcare information all the time. Does this actually, work? Does it cut through all that noise?
It really does. They're seeing engagement rates that are way above industry average. And the reason is, I think, they really focus on personalized content that resonates with, with each person.
Oh, okay.
So it's not just generic stuff. They're tailoring the communication.
That's smart.
Yeah.
So they're identifying the people who need help, and then they're getting them engaged.
Right.
What's next? How do they actually give the care?
So they've created this really cool system that blends virtual and in-person care options. So patients can have on-demand access to specialists, physical therapists, all that kind of stuff, all from home.
Oh, wow. So let's say I hurt my knee or something.
Yeah.
I could have a virtual consultation with an orthopedic specialist without even, leaving my house.
Exactly. It's all about being convenient and efficient.
Okay, so that makes sense. But, I mean, there are so many providers out there. How do they make sure that people are getting the best quality of care?
Right. That's where their data-driven approach comes in. They have something called provider efficiency scores. Think of it as this massive database with info that evaluates provider quality.
Okay.
So they've analyzed data from, get this, over 10 billion claims and 130 million patients.
What?
To figure out which providers are delivering the best care.
Wow. So they're not just relying on reputation or word of mouth. They're really crunching the numbers to find the best of the best.
Exactly. And it goes even further. They consider quality and then risk adjustments based on patient conditions, different areas of expertise, and even the provider's location.
Oh, so they can match people with providers in their area.
Exactly. So it's really top-notch care that's convenient.
So it's data-driven, it's personalized, they're taking on the risk. It sounds like they've got to have a pretty big network of providers to pull all of this off.
Yeah, it's massive. I mean, it spans 45 states.
Yeah.
It includes over 5,000 orthopedic specialists, 3,500 physical therapists, and then a huge network of imaging centers, ambulatory surgery centers, hospitals, you name it.
Wow. They really have everything covered.
They do. And it all comes back to their mission of making top quality care accessible and, affordable.
It sounds like they're thinking long term, too. Are they also focused on preventing these types of problems from happening in the first place?
Totally. They're putting a lot of resources into R&D to try and understand what causes these orthopedic problems and figure out new ways to solve them.
So it's not just treating the symptoms. It's really getting to the root of the problem.
Exactly. And again, it comes back to their commitment to being this like full risk partner. They're not just providing a service, they're owning the entire patient journey.
It's amazing to see a company so dedicated to,
Mhm.
to really changing things up in healthcare. It does make you wonder, though, could this type of approach work in other areas beyond orthopedics?
That is the question, isn't it? And
Huh.
honestly, the potential is huge.
Yeah.
I mean, imagine the same model, but for like cardiology, oncology, or even mental health.
Wow.
I mean, the possibilities are just, they're really exciting.
Yeah, it's really interesting to think about, like, what kind of ripple effect could this have on the healthcare system as a whole?
Right, totally. I mean, think about something like chronic disease management.
Chronic disease management.
Yeah,
Right.
like conditions like diabetes or heart disease, right? They often need ongoing care, and you need to make changes to how you live, which can be tough to keep up with on your own. Icon Health's whole model, the way they emphasize reaching out to people, personalized support, coordinating care, that could be really effective in helping people manage those conditions
Right.
and,
There.
prevent problems down the road.
Yeah. And I mean, think about the cost savings too, right?
Huge.
Chronic diseases, they're like the biggest driver of healthcare spending in the U.S.
Right.
If we can get a handle on that, I mean, we could save a ton of money.
Exactly. And it's not just about money either. Like, think about people's quality of life.
Right.
Living with a chronic disease, that's hard. But Icon Health's approach could really help people take control of their health,
Yeah, for sure.
live better, healthier lives.
It's a great vision. But let's be real, there are going to be some hurdles along the way.
Of course.
Like, what about data privacy?
Hmm.
With all this data they're collecting and analyzing, how do we know patient info is protected?
That's the big question, right? And it's one that Icon Health takes seriously. They've got these really strict security protocols in place. They follow all the privacy regulations. You know your information's safe with them.
Right.
They're really transparent, too,
Right.
about how they use data. And patients have control over their own info.
Okay, so transparency and control, those are key.
Absolutely.
But, I mean, this is a pretty complex platform.
Yeah,
Doesn't that take a lot of money?
it does. You need the tech.
Right.
You need the expertise. But Icon Health is, well, they seem ready to tackle that. They've got this amazing team of engineers, data scientists, healthcare professionals.
Yeah.
They're always coming up with new stuff, improving their platform.
So they're really committed to staying ahead of the curve.
Totally.
It's great that they're bringing all these different experts together to create like a unified healthcare experience.
It is.
It's really impressive to see their dedication to pushing the boundaries of what's possible.
For sure. I mean, their approach is innovative, ambitious, and most importantly, it focuses on patients.
Right. So how does this all play out for the average person? How could Icon Health's model change our experience with healthcare in the future?
Well, if their model works and can be scaled up,
Yeah.
we might start to see a shift towards more proactive care, personalized care, more integrated care.
Yeah.
It's a future where it's less about reacting to problems and more about preventing them from happening in the first place.
That makes sense. Like imagine if AI could tell us about health risks early on
Yeah,
and then give us advice on how to prevent or treat them.
exactly.
So instead of dealing with this complicated, confusing healthcare system, it'd be more seamless
Right.
and efficient.
Definitely something to aim for. And companies like Icon Health, they're leading the way, showing us there's a better way.
That's a good point. Healthcare doesn't have to be this way.
It doesn't.
We can create a system that's, more responsive, more effective, and really puts people first.
Absolutely.
Their approach is, well, it's inspiring. It shows what's possible when you use tech and data the right way with a focus on well-being.
Absolutely. But what about other areas where this could work?
Right.
Seems like there's a lot of potential.
Yeah, totally.
What do you think? Well, think about mental health care.
And mental health care, okay.
It's so stigmatized.
Yeah.
It can be really hard to find help. But imagine if Icon Health's model could connect people with mental health professionals.
Oh, okay.
Easier, and give them the support they need.
That would be incredible. I mean, mental health is just as important as physical health, right?
Right.
And we need to do so much better at supporting people who are struggling.
Exactly. And with Icon Health's model, the focus on reaching out and personalizing care, that could make a huge difference.
So we've got chronic disease management, mental health care.
Yeah.
What other areas could benefit?
I think elder care is a big one.
Elder care. Okay.
I mean, we're all getting older.
Right,
The
yeah.
need for elder care services is only going to increase. And the traditional ways of doing things are just, they're too expensive, too fragmented. Icon Health's model could provide a better solution with the care coordination, in-home support.
Right.
It could be more holistic and affordable.
That's a really interesting thought. Imagine seniors getting personalized care at home,
Right?
techers connecting them to doctors and support services.
Seamlessly?
It would totally change how we think about aging.
It would. And it would give seniors more independence,
Right.
better quality of life for longer.
It's pretty amazing to think about the impact Icon Health's model could have
It is.
on all these different areas of healthcare. They're a great example of how innovation can really improve lives.
For sure. And I'm really excited to see how their model changes and grows over time. Who knows what they'll do next?
I know, right? I think for everyone listening, the big takeaway is that we need to be willing to shake things up when it comes to healthcare.
Exactly.
Icon Health is showing us there are better ways to do this. More patient-centered, more data-driven,
Right.
really focused on getting the best results.
And you know what? You don't have to be a healthcare expert to make a difference.
That's true.
Just stay informed, ask questions, share your experiences.
Right.
That helps create change.
Absolutely. Everyone's voice matters.
Mm.
And the more we talk about this stuff, the better chance we have of seeing real progress.
Yeah, it's really inspiring to see companies like Icon Health kind of, blazing a trail and showing us what's possible when we think outside the box about healthcare.
I agree. And sometimes it doesn't even have to be these huge, monumental shifts.
Right.
Little things can make a big difference too.
What do you mean?
Well, look at how Icon Health uses AI to personalize those messages they send to patients.
Right.
That's a pretty simple idea, but it can totally change how patients engage with their own care.
Yeah, you're right. It's about using technology in a smart way,
Yeah,
not to replace human connection, but to make it better.
exactly. And that's something we can all take away from this, whether we're doctors or, people making policy or just regular people trying to figure out healthcare. So if there's one thing you want our listeners to remember from all of this, what would it be?
I think the big thing is this. The future of healthcare is up to us. We don't have to just accept things the way they are. We can ask for better care. We can support companies that are trying new things and really pushing the boundaries.
That's a good point. And you know what? You don't have to be a doctor or a scientist to make a difference.
Right.
Just staying informed, asking questions, sharing what you've experienced, all that can lead to good changes.
Absolutely. Everyone's voice is important here.
Yeah.
And the more we talk about these things, the more likely we are to see real progress.
Well, this has been a really fascinating look at Icon Health and what they're doing in orthopedic care.
It has.
They've given us a lot to think about.
They have. And I hope that their model inspires other companies to, to think differently about healthcare, to make it more personal, more accessible, and just better for everyone.
Thanks for spending 10 minutes with us, and be sure to look for more 10-minute health tech podcasts. Bye.